Hi, I'm Dr. David Hill, and today we're going to talk about how to cure your baby's sore throat. Now, when we talk about babies, I'm really thinking about infants. I'm thinking about children between the ages of birth and 12 months. Sore throats don't tend to be a problem at the beginning of this period unless they're due to thrush. What's thrush? It's actually a yeast infection of the inside of the mouth. And if you see thick white patches on the inside of the mouth that won't scrape off with a washcloth or a fingernail, that's probably a yeast infection or thrush, and that's something that's going to be need to be treated with medication to make it go away. Now, when I think about sore throats in slightly older babies, I think mainly about viral sore throats. The good news is strep is almost unheard of in infants. Why is that? Well, they still have a lot of mom's antibodies to fight off the strep bacteria. So it is very unusual to see a strep throat in a baby who is less than 12 months of age. What do they get? Well, they can get these really nasty viral infections of the inside of the mouth and the inside of the throat. This is called a stomatitis. The bad news is there's no medication that cures stomatitis. It has to get better on its own, usually in about 7 to 10 days' time. But in the meantime, it can be really miserable. So what can you do? Well, if you see these nasty sores and ulcers on the inside of the mouth, you really want to keep your baby hydrated. You want to keep plenty of fluid going in. Use, if it's an infant, instead of milk, you want to use formula or breast milk, maybe at room temperature, maybe slightly cool, but not too warm, not too cold. Pedialyte may help. You want to avoid acidic things like juice. Water may do the trick. You can also help with the pain by using ibuprofen or acetaminophen pain controllers, or you can even use a little bit of Maalox or Mylanta on the sores themselves to make them hurt less. Now, if your baby seems to have a really bad sore throat and is having trouble feeding and getting enough fluid in to stay well hydrated, you really want to seek a doctor's care. They may have some other ideas for you, or they may even want to hospitalize your child until the sore throat is better and give them IV fluids. So, talking about what you can do to cure a sore throat in your baby, I'm Dr. David Hill.